It's a randomized trial between Melflufen dex and pomalidomide dex in patients who have received 2 to 4 prior lines of treatment and were refractory to lenalidomide. Yeah, it's a quite standard randomized trial with a randomization 1-to-1 between the two arms. Contrary to most myeloma randomized studies, this is a head-to-head study with 2 different drugs. So one is a standard and one is a novel drug, Melflufen. Most randomized studies in myeloma are add-on studies where you give the same treatment and you add on one drug in the intervention arm. So this is a head-to-head study, which sometimes creates a sort of different type of results because you will more often see subgroups benefiting from one or the other, while in an add-on study, usually most subgroups are benefiting from the new treatment since it's both the old and the new treatment at the same time. And pomalidomide dex was given in a approved standard dosing, and Melflufen was an intravenous drug given once every cycle of 28 days. And then was the primary endpoint was PFS, and normal secondary endpoints were overall survival and overall response rate and such. Primary endpoint was positive with an increase in progression-free survival from about 4.9 for pomalidomide and 6.3 about there for Melflufen dex. So it's a positive study with a positive primary endpoint. However, we saw that there was, even though it wasn't statistically significant, there was a slight numerical increase in mortality in the intervention arm. So that led to a partial clinical hold in ongoing studies for Melflufen. What we did see in the subgroups, especially the subgroup which is half of the patients in the study, that is the subgroup who had previously received a transplant or not, we saw that Melflufen dex benefited also in overall survival as well as in PFS, the patients who had not received a previous transplant, while pomalidomide, especially for OS, benefited the patients who had received a previous transplant. So this actually gives a result that you can use in picking patients who would benefit from one treatment versus the other. Adverse events were in line with previous reports on the 2 drugs. For Melflufen, the new drug, that's mainly hematological. There's a large fraction of the patients who experience thrombocytopenia and neutropenia and anemia, and more than pomalidomide arm. But these were mainly manageable, and you saw that only 1%, if you're discussing thrombocytopenia, only 1% of the patients had a severe bleeding. And regarding neutropenia, you actually saw that there were more infections in all types of infections in the pomalidomide arm. So it was not sort of more infections than expected, maybe even less. And anemia is not such a problematic thing to manage. And besides the hematological adverse events, there wasn't any signal of any other adverse event that happened in a fraction of the patients. Now there's a pending decision by the FDA with this partial clinical hold, and they're looking into the data we have discussed now and was showed at the conference, and also, of course, even more detailed data than that. My belief is that they will approve the continuous development of Melflufen in patients who have not received a previous transplant. I think they will probably say that patients who have received a previous transplant, especially within the last 5 years, should not be treated with pomalidomide. So, but in the patients without the transplant, this is the results are better than for pomalidomide. There would be a a new standard of care for the patients who would otherwise have received pomalidomide. This is an alkylator, so it's also interesting what happens to patients who are refractory to alkylators. And in that setting, we saw that both PFS and OS was much improved by melflufen versus pomalidomide dex in the patients who were alkylator refractory if they were not transplanted. So it's the transplant that's a problem, not the alkylator in itself. So it also confirms, or at least strengthens the argument that melflufen is not just another alkylator. It's a better alkylator than the ones we have on the market as of today, as long as you're not giving them to patients who are recently transplanted.